I am Soumik Kar, student of P.G.G.I.P.E BANIPUR. Today the topic of my presentation is yoga and lifestyle. So today the table of the content is yoga and lifestyle, Yogasana as preventive measure, benefits of Yogasana, obesity, diabetes, asthma, hypertension, short answer essay type question, yoga and lifestyle related, long answer type question, yoga and lifestyle related, case based question, yoga and lifestyle related, frequency asked question, yoga and lifestyle related. At first we will know what is yoga and lifestyle. Now I will briefly discuss what is yoga and lifestyle. Next we will know step by step yoga and lifestyle. First is yoga and lifestyle both are interrelated, অর্থাৎ যোগা এবং লাইফস্টাইলটা আমাদের একটার সঙ্গে অন্যটার ইন্টাররিলেটেড. If you do yoga regularly, then you can lead a good lifestyle. যদি তুমি প্রতিদিন যোগা অভ্যাস করো তাহলে তোমার একটি ভালো দৈনন্দিন জীবন ছন্দের তুমি সম্মুখীন হতে পারবে বা ভালো একটি দৈনন্দিন জীবনে নিয়ে এগোতে পারবে. Asanas are third step of 8 elements after yoma and niyama. Asanas are the third step. Asana holo third step. 8 elements of after yoma and niyama third step holo asanas. Asanas are slow stretching activities. Asana holo slow stretching activities in which holding body posture brings stability of body and poise to mind. In which holding body posture আমাদের body posture যেটা রয়েছে স্টেবিলিটি স্থিতিবস্থা ও বডি অ্যান্ড পয়েজ টু মাইন্ড. বডি আমাদের আসনা প্র্যাকটিস করলে আমাদের বডির মধ্যে স্থিতিবস্থা বজায় থাকে এবং বডি অ্যান্ড পয়েজ টু মাইন্ড মানসিক দিক থেকে এবং শারীরিক দিক থেকে এটা খুব উপকারী. যোগাসনা আর ক্যাটাগরিজড ইন্টু 3 পার্টস. যোগাসনকে সাধারণত 3টি ভাগে ভাগ করা যায়. কী কী রয়েছে? কালচারাল আসানাস ফর ওভারঅল বডি ফিটনেস. যে 3 ভাগে ভাগ করা যায় সেটা কি? কালচারাল আসানা ফর ওভারঅল বডি ফিটনেস এটা রয়েছে. সেকেন্ডে মেডিটেটিভ অ্যান্ড রিল্যাক্সেটিভ আসানা ফর ইমপ্রুভিং মেন্টাল অ্যাক্টিভিটিস এটা সেকেন্ড. অ্যান্ড থার্ড থেরাপিউটিক আসানা ফর কিউরিং ভ্যারিয়াস হেলথ প্রবলেম. ফার্স্টে রয়েছে কালচারাল আসানা. কালচারাল আসানা প্র্যাকটিস করলে কি হয়? ফর ওভারঅল বডি ফিটনেস, আমাদের সম্পূর্ণ বডির যে ফিটনেসটাকে বজায় রাখার জন্য কালচারাল আসানা ইজ দ্য মোস্ট ইম্পর্টেন্ট. সেকেন্ড মেডিটেটিভ অ্যান্ড রিল্যাক্সেটিভ আসানা ফর ইমপ্রুভিং মেন্টাল অ্যাক্টিভিটিস. মানসিক বিভিন্ন অ্যাক্টিভিটির দিক থেকে খুব উপকারী যেটা সেটা হলো মেডিটেটিভ অ্যান্ড রিল্যাক্সেটিভ আসানা. থেরাপিউটিক আসানার মধ্যে কী রয়েছে? ফর কিউরিং ভ্যারিয়াস হেলথ প্রবলেম, আমাদের স্বাস্থ্যের যত সমস্যা সেটাকে ঠিক করার জন্য থেরাপিউটিক আসানা ইজ দ্য মোস্ট ইম্পর্টেন্ট. তো নেক্সট আমরা জানবো দিস আসানা আর পারফর্মড ইন স্ট্যান্ডিং, সিটিং অ্যান্ড লাইং অর ইনভার্টেড পশ্চার. এই আসনগুলো কালচারাল আসানাস, মেডিটেটিভ অ্যান্ড রিল্যাক্সেটিভ আসানাস, থেরাপিউটিক আসানাস এগুলো সাধারণত আমাদের সিটিং বসে এবং লেইং ডাউন অর ইনভার্টেড পশ্চারে আমরা এটি করতে পারি. দ্য ওয়ার্মিং আপ ইন যোগা ইজ পারফর্মড উইথ সূর্য নমস্কার. দ্য ওয়ার্মিং আপ ইন যোগা ইজ পারফর্মড উইথ সূর্য নমস্কার. যে সূর্য নমস্কার মানে যোগার যেই ওয়ার্মিং আপ যেটা সেটা আমরা কী দিয়ে ওয়ার্মিং আপ করি? সেটা হলো সূর্য নমস্কার. সূর্য নমস্কার দিয়ে আমরা সবার প্রথমে এটা স্টার্ট করি যোগা ওয়ার্ম আপ. যোগাসনা আর স্লো স্ট্রেচিং অ্যাক্টিভিটিস ইন হুইচ হার্ট রেট, ব্রিদিং রেট অ্যান্ড বডি টেম্পারেচার রিমেইন নর্মাল. যোগাসনা একটি স্লো স্ট্রেচিং অ্যাক্টিভিটিস যেটি আমাদের হার্ট রেট, শ্বাস প্রশ্বাস, ব্রিদিং রেট, শ্বাস প্রশ্বাস রেট অ্যান্ড বডি টেম্পারেচার আমাদের শরীরের তাপমাত্রাকে নর্মালে আনতে সাহায্য করে. The effect of asanas are internally felt and not observable. The effect of asanar যে এফেক্ট সেটি ইন্টারনালি ফেল্ট অ্যান্ড নট অবজারেবল. এটি কি যদি আমরা যে এফেক্ট রয়েছে এটি খুব ভালো এফেক্ট রয়েছে, কিন্তু এটা যদি আমরা ইন্টারনালি দেখতে চাই এটি খুবই উপকারী আমাদের শরীরের ক্ষেত্রে. নেক্সট আমরা যেটা জানবো সেটা হলো যোগাসনা অ্যাজ প্রিভেন্টিভ মেজার. কী কী রয়েছে? যোগাসনা হ্যাভ গ্রেট কিউরেটিভ, প্রিভেন্টিভ অ্যান্ড থেরাপিউটিক এফেক্টস. যোগাসনের বিভিন্ন কিউরেটিভ, প্রিভেন্টিভ অ্যান্ড থেরাপিউটিক বিভিন্ন এফেক্ট রয়েছে যোগাসনের. আসানাস ক্যান কিওর অ্যান্ড প্রিভেন্ট মেনি ক্লোরিং হেলথ প্রবলেম সাচ অ্যাজ. যেই আমাদের শারীরিক যে সমস্যাগুলো সেগুলো আমাদের আসনা কীভাবে ইমপ্রুভ করে, সেগুলো কী কী। স্কেলিটাল অর অর্থো রিলেটেড প্রবলেম, আমাদের স্কেলিটাল এবং অর্থো রিলেটেড যে প্রবলেমস রয়েছে তার মধ্যে কি আসানাস ক্যান প্রিভেন্ট অ্যান্ড কিওর মেনি অর্থো রিলেটেড প্রবলেম সাচ অ্যাজ কাইফোসিস, রাউন্ড শোল্ডার, লর্ডোসিস, স্কোলিওসিস, নকনিস, বোলেগ, ফ্ল্যাট ফুট, নেক অ্যান্ড স্পন্ডিলাইটিস। আসানাস কী কী আমাদের প্রিভেন্ট করতে পারে, কিওর মেনি অর্থো রিলেটেড প্রবলেম কি সাচ অ্যাজ কাইফোসিস, ইফ এনি পার্সন kyphosis related any problem he or she will face, then asana will improve his or her preventive measure. তো আসনস কি করে, আসনাস প্র্যাকটিস করলে এই কাইফোসিস, রাউন্ড শোল্ডার্স, লর্ডোসিস, স্কোলিওসিস যে প্রবলেমগুলো এগুলোতে অনেক উপকার পাওয়া যায়। নেক শোল্ডার্স, নেক স্পন্ডিলাইটিস এই প্রবলেমগুলোতে অনেক উপকার পাওয়া যায়। নেক্সট রয়েছে ডাইজেশন রিলেটেড মানে যেটা আমাদের হজম সংক্রান্ত যেটা রয়েছে ডাইজেস্টিভ সিস্টেমের মধ্যে। আসানাস ক্যান প্রিভেন্ট অ্যান্ড কিওর মেনি ডাইজেস্টিভ রিলেটেড হেলথ প্রবলেম, ডায়াবেটিস, ওবেসিটি, আন্ডারওয়েট, কনস্টিপেশন, ফুড ইনটলারেন্স, গ্যাস্ট্রিক প্রবলেম অ্যান্ড মেনি মোর। আসানাস আমাদের যেটি কী করে, আমাদের যে প্রবলেমগুলো সমস্যা সমাধান করে ডাইজেস্টিভ প্রবলেম, তার মধ্যে রয়েছে ডায়াবেটিস, ওবেসিটি, মেধাধিক্য, আন্ডারওয়েট, লুজ ওয়েট, কনস্টিপেশন, ফুড ইনটলারেন্স, গ্যাস্ট্রিক প্রবলেম অ্যান্ড মেনি মোর। অনেক ধরনের ডাইজেস্টিভ প্রবলেম রয়েছে, সেগুলোকে আমাদের সারাতে আসানাস ইজ দ্য মোস্ট ইম্পর্টেন্ট। থার্ড ইজ কনসেন্ট্রেশন রিলেটেড প্রবলেম, আমাদের কোনো একটা কিছু ফোকাস করছি, কনসেন্ট্রেট করছি কোনো একটা বিষয়ের উপরে, সে তার প্রবলেম সমস্যা সমাধান করার জন্য আসানাস ইজ দ্য মোস্ট ইম্পর্টেন্ট। আসানাস প্রিভেন্ট অ্যান্ড কিওর স্ট্রেস অ্যান্ড টেনশন, কন্ট্রোল অ্যাংজাইটি, স্টেবিলাইজ মাইন্ড অ্যান্ড ইমপ্রুভ মেমোরি। আসানা আমাদের প্রিভেন্ট করে কিওর স্ট্রেস, আমাদের চিন্তা, আমাদের কোনো একটি বিষয় নিয়ে অত্যাধিক স্ট্রেসে থাকা, টেনশন, কন্ট্রোল অ্যাংজাইটি কোনো কিছুর উপরে উদ্বেগ, স্টেবিলাইজ অ্যান্ড ইমপ্রুভ মেমোরি কোনো কিছু স্মরণশক্তি ধরে রাখার কাজে, এই সমস্ত কিছু আমাদের অনেক প্রবলেমে ফেস করতে হয়, সেগুলোকে আমাদের অনেক উপকার করে আসানাস। Fourth is immunity related problem. What is the immunity related problem? Asanas can improve the immunity to a good extent, thus prevent cold, cough, viral infection, communicable disease, asthma, etc. Asanas আমাদের ইমপ্রুভ করে ইমিউনিটি, আমাদের ইমিউনিটি পাওয়ার, নিজেদের সহ্য ক্ষমতা যেটাকে আমাদের ইমপ্রুভ করে, তার মধ্যে রয়েছে গ্রেট এক্সটেন্ট, দাস প্রিভেন্ট কোল্ড, কোনো একটি ঠান্ডা, কোনো একটি প্রবলেম হচ্ছে ঠান্ডাতে, সেটাকে ঠিকভাবে আমাদের সেই সময় তার ঠান্ডার সাথে নিজেকে মানিয়ে নেওয়া, ভাইরাল ইনফেকশন, কোনো একটি ইনফেকশন হয়েছে সেটাকে নিজে থেকে কন্ট্রোল করা, কমিউনিকেবল ডিজিজ, অন্যান্য বিভিন্ন রোগ রয়েছে, আজমা এক্সেট্রা, এই প্রবলেমগুলোকে আমাদের অনেক উপকার করে আসানাস প্র্যাকটিসের ফলে। ফিফথ ইজ কার্ডিয়াক রিলেটেড কি, ইট অলসো প্রিভেন্ট করোনারি আর্টারি ডিজিজ, হার্ট অ্যাটাক, কনজেস্টিভ হার্ট ফেলিওর অ্যান্ড ভ্যারিয়াস ব্লাড প্রেশার। বিভিন্ন ব্লাড প্রেশার এবং হার্ট অ্যাটাক, কনজেস্টিভ হার্ট অ্যাটাক, ফেলিওর, এগুলোতে অনেক ইট উইল বি মোর এফেক্টিভ asanas for this problem. Nerve related problem, it prevents paralysis, cythasia, Parkinson, weak muscle cramps. This type of problem, if you practice everyday yoga and asanas, this type of problem you will never face and anymore or any day. So at first summarize the total topic. Yogasana as preventive measure. First one is skeletal or ortho related problem, second digestion related, third concentration related problem, fourth immunity related problem, fifth cardiac related, and sixth is nerve related. If any person everyday practice yoga and this type of problem he will never face. Okay, next we will know what is the benefits of yogasana. The benefits of yogasana is it improves physical and mental abilities to a great extent. The main benefits of yogasana is it improves our physical and mental abilities to a great extent. Second is it increase the concentration and control behavior. This type of if you practice everyday yogasana, it increase our concentration and control behavior, it will be increased. Our third is our bones and joints become strong. আমাদের হাড় এবং জয়েন্টস অনেক শক্তিশালী হয়। ইনক্রিজ ব্লাড সার্কুলেশন, রক্ত চলাচল অনেক বৃদ্ধি পায়। রেসপিরেটরি অর্গানস বিকাম স্ট্রং অ্যান্ড এফিসিয়েন্টস, রেসপিরেটরি যে অর্গানস রয়েছে অনেক শক্তিশালী হয় এবং এফিসিয়েন্ট হয়। এফিসিয়েন্সি অফ ডাইজেস্টিভ সিস্টেম ইনক্রিজ, আমাদের ডাইজেস্টিভ সিস্টেম অনেক বৃদ্ধি করে, এফিসিয়েন্টস হয়। নার্ভাস সিস্টেম গেটস স্ট্রেংথেন, আমাদের নার্ভাস সিস্টেম অনেক শক্তিশালী হয়ে যায়। গ্ল্যান্ডুলার অ্যাক্টিভিটি ইজ স্টিমুলেটেড অ্যান্ড regulated properly, efficiency of excretory system enhance. Fifth is and 1 2 3 4 5 6 7 8 9 is immune system gets strengthened, আমাদের ইমিউনিটি পাওয়ার অনেক শক্তিশালী হয়। ইমপ্রুভ কার্ডিওভাস্কুলার সিস্টেম, কার্ডিওভাস্কুলার সিস্টেমের মধ্যে হার্ট, লাংস, ব্লাড ভেসেলস রয়েছে, এগুলো অনেক ইমপ্রুভ হয়। কন্ট্রোল ওভার সেন্স অর্গ্যানস, আমাদের অর্গ্যানসগুলো অনেক ইমপ্রুভ হয়, কন্ট্রোল করতে পারে। ইট গিভস রিল্যাক্সেশন ফ্রম স্ট্রেস অ্যান্ড টেনশন, এটি আমাদের স্ট্রেস এবং টেনশনকে দূর করে। ইট ডেভেলপ গুড পশ্চার, এটি আমাদের ভালো শারীরিক গঠনে অনেক সাহায্য করে। ইট রিমুভস অর্থ প্রবলেমস, অর্থ রিলেটেড এনি টাইপ অফ প্রবলেম এনি পার্সন will be face, then this if he practice everyday yoga benefit, this is the benefits of yoga, if he practice everyday yoga this type of problem never will be face. It prevent aging, this type of problem, and last is it prevents premate aging. So today we'll know 1 2 3 4 5 6 7 8 9 10 11 12 13 14 15 15 benefits of yogasana today we'll know. Next we'll know obesity. Obesity means in Bengali মেধাধিক্য। মেধাধিক্য বলতে আমরা কি বুঝি? obesity is a condition in which excess body fat has accumulated to the point that it may have a negative effect on health. Obesity is a condition in which excess body fat has accumulated to the point that it may have a negative effect on health. The excess fat of the body gets deposited under the skin, especially in areas like the abdomen, chest, shoulder, buttocks and legs. When this if any person every day he will never exercise and lay down every day in his bed, on his or her bed, then this type of problem will be never face, and he will face this problem. Obesity is a condition in which excess body fat accumulates to the point that it may have negative effect on health. And second stanza is obesity increase the likelihood of various disease and can be result of genetic environment factors or a combination of both. Obesity বৃদ্ধি করে লাইকহুড টু দ্য ভ্যারিয়াস ডিজিজ, আমাদের বিভিন্ন রকম ডিজিজ রয়েছে সেটাকে অনেক পরিবর্তন করতে। ক্যান বি রেজাল্ট অফ জেনেটিক এনভায়রনমেন্ট ফ্যাক্টরস or a combination of both, দুটোর কম্বিনেশন। one needs to be aware of the potential risk due to their weight, তাদের নিজেদের ওয়েট যতটা রয়েছে সেটাকে কন্ট্রোল করার জন্য কিন্তু কন্ট্রোল করতে পারে যোগাসন। In today's world where nearly everyone is overweight, in today's world আজকালকার দিনে where nearly everyone is overweight, আজকালকার দিনে অনেকেই এই অত্যাধিক পরিমাণে ওজন এর ফেস করছে। obesity is becoming more commonplace, obesity হচ্ছে একটি becoming more obesity একটি মেধাধিক্য আমাদের একটি সাধারণ জীবনছন্দের মধ্যে চলে এসেছে। obesity leads to many health problem, মেধাধিক্য আমাদের বিভিন্ন শারীরিক প্রবলেম তৈরি করে। yogasana can cure these problem by increasing physical activity and controlling glandular function. yogasana can cure this problem, এটি এই প্রবলেমগুলো আমাদের ফিজিক্যাল অ্যাক্টিভিটি অ্যান্ড কন্ট্রোলিং গ্ল্যান্ডুলার ফাংশন, বিভিন্ন ধরনের যোগাসন প্র্যাকটিস করলে আমাদের এই ওবেসিটি রিলেটেড এরকম বিভিন্ন হেলথ রিলেটেড প্রবলেম আমাদের কোনো সময় ফেস করতে হবে না। নাও ইউ উইল নো সাম আসানাস। Vajrasana. What is the procedure of Vajrasana? Sit with flexed leg. When a person sit in front of the floor, at first what is the procedure? Sit with flexed leg. Second is hands over the knees. At first he lay down on the floor, next his hand over his knees, back straight, his back must be straight, should be straight, toes behind his our leg have a toe and toes behind and heels joined, body resting over the ankle and our body resting over the ankle. Benefits. What is the benefits of this problem? What is the benefit of this? Control obesity. এটি আমাদের ওবেসিটিকে অনেক কন্ট্রোল করতে পারে। ইমপ্রুভ লেগ মাসল, আমাদের পায়ের বিভিন্ন মাসেল রয়েছে সেটাকে অনেক ইমপ্রুভ করে। কিওর্স গ্যাস্ট্রিক প্রবলেম, বিভিন্ন গ্যাস্ট্রিক প্রবলেম রয়েছে সেটাকে অনেক ইমপ্রুভ করে বজ্রাসন। অ্যান্ড রয়েছে কন্ট্রেন্ডিকেশনস। অ্যাভয়েড ইফ ইউ হ্যাভ সিভার নি পেইন, যদি কারোর কোনো পায়ে মানে হাঁটুতে যন্ত্রণা থাকে বা ব্যথা থাকে তাহলে তাদের এটা করা উচিত নয়। অ্যাভয়েড ইফ ইউ হ্যাড রিসেন্ট সার্জারি অর লেগস, যদি তার খুব রিসেন্ট তার পায়ে কোনো সার্জারি হয়ে থাকে, পায়ে কোনো সমস্যা থাকে তাহলে এটা করা উচিত নয়। ইফ ইউ ফিল পেইন ইন দ্য অ্যাঙ্কেল জয়েন্ট, যদি অ্যাঙ্কেল জয়েন্টে কোনো পেইন থাকে তাহলে ব্যথা থাকে তাহলে তার এটা করা উচিত নয়। তাহলে বজ্রাসনটার একটি শর্টে একটু জেনে নিই আরেকবার। What is the procedure of Vajrasana? At first one is sit with flexed leg. Second, hands over the knees. Third, back straight, toes behind, heels joint. Fourth, body resting over the ankle. What is the benefit of Vajrasana? Controls obesity, এটি আমাদের মেদ দূর করতে সাহায্য করে। ইমপ্রুভ লেগ মাসল, পায়ের মাসলকে ইমপ্রুভ করে। কিওর্স গ্যাস্ট্রিক প্রবলেম, গ্যাস্ট্রিক প্রবলেমকে অনেক উপকার করে এটা, গ্যাস্ট্রিক প্রবলেম হলে সেটাকে সারিয়ে দেয়। Contraindications মধ্যে রয়েছে অ্যাভয়েড ইফ ইউ হ্যাভ সেভারাল নি পেইন, অ্যাভয়েড ইফ ইউ হ্যাড রিসেন্ট সার্জারি অর legs, if you feel pain in the ankle joint. Second is Trikonasana. What is the Trikonasana? What is the procedure of Trikonasana? The procedure of Trikonasana is stand with your leg apart. At first you lay down on the floor, stand with your legs apart, raise the arms sideways up the shoulders level. Third, bend the trunk sideways and raise the right hand upwards. Do it on the next side. What is the benefit of Trikonasana? Benefits of Trikonasana is it strengthens and leg muscles, knees, arms and chest. Second, help in improving digestion and stimulates all the abdominal organs. Third, increase mental and physical equilibrium, reduce stress, anxiety, back pain and cythasia. The contraindications of this Trikonasana is avoid doing this asana if you have diarrhea, low or high blood pressure, back injury or migraine. You will never try this asanas, Trikonasana. Avoid in case of several spondylosis. This type of problem will be, if you have this type of problem you will never try this asanas. The asana's name is Trikonasana. And the third asana is Padhasthasana. What is Padhasthasana? This is Padhasthasana. What is the procedure of Padhasthasana? Bend forward, touch the floor of 8 sides of the feet, keep your knees straight, try to touch the knees with the forehead. Benefit. What is the benefit of Padhasthasana? Body become flexible and stretches the back and leg muscle, remove excess belly fat, improve digestion and reduce constipation. What is the contraindication of these asanas? Individuals who have back pain should avoid this asana. At least they should not behind forward fully. This is Padhasthasana. At first I will repeat this. What is Padhasthasana? What is the procedure of Padhasthasana? The procedure of Padhasthasana is bend forward, touch the floor, either side of the feet. At you touch the floor or side of the feet, keep your knee straight. You should be keep your knee straight. Try to touch the knees on the forehead. What is the benefit of the Padhasthasana? Body become flexible and stretches the back and leg muscle, remove excess belly fat. This type, if you practice every day, when person this type of problem, this problem is obesity person, if practice the Padhasthasana he removes this type of problem, removes excess of belly fat, improve digestion and reduce constipation. This is the benefits. And contraindication of individuals who have back pain or should avoid the asthma. At last they should not bend forward fully. Fourth is the Ardha Matrasana. Ardha Matrasana asana. The procedure. What is the procedure of these asanas? The left heel is kept under the right thigh. At first, the procedure is the left heel is kept under the right thigh. Right leg is crossed over the left thigh. Hold the right toe with the left hand and turn your hand and back to the right side. Perform the same asanas in the reversed position. Next is, what is the benefits? What is the benefits of this asana? The benefits of the asana is keeps gallbladder and the prostate gland healthy, enhance the stretchability and back muscle, and elevates digestive elements. The contraindications of women are pregnant should avoid these asanas. Individuals who suffer from peptic ulcer hernia and should perform these asanas only under the expert guidance. This is the Ardha Matrasana asana. Now you will know the next problem is diabetes. If you practice the asanas every day, you will never such this type of problem will never face. Okay, next is the diabetes. Yoga for diabetes. In the diabetes of yoga, this four type of exercise will be practiced regularly. This time you will never face this problem diabetes. First is Bhujangasana and Pushy Matasana, and third is Pawan Mukhtasana and Urdhva. This type of four exercise you will, if you practice every day, you will never face this type of problem diabetes. Now I will go to the main topic, diabetes. Diabetes occurs when sugar builds up in our bloodstream instead of being used by the cells in our body. Diabetes is a disease in which the body is unable to produce insulin, the hormone that regulates blood sugar levels. This can lead to increased sugar level in the blood, which can affect organs, causing blindness, kidney failure, cardiovascular disease, and impotence. There are these three main types of diabetes. Type 1 diabetes results from an autoimmune disorder. Type 2 is diabetes developed when the body produces insulin but does not use to properly. Gastronomial diabetes occurs only during pregnancy. Insulin, hormone that your body produces to help make glucose from your food. Insulin help carry the glucose from the blood into muscle, fat, and liver cells. It also keeps sugar from building up the bloodstream. When you have a lot of insulin in your system, it means that these cells are absorbing more glucose from your blood and they would normally do. Now we will know what is the exercise of the diabetes. The diabetes is first one is the exercise is Bhujangasana. What is the procedure of Bhujangasana? Lie down on the belly, and then next is raise the upper part of the body with the support of your hands. Third is look up. If you practice every day this Bhujangasana, what is the benefits on your health? It prevents and cures diabetes. It improves digestive functioning. It cures cold and bronchial problems, kyphosis, obesity, neck, and spondylitis. It provides strength and agility. This type of if you practice every day Bhujangasana, these benefits will be seen. And third is the contraindications. What is the contraindication? These asanas should be avoided by individuals who suffer from hernia, back injuries, head catches, and the recent abdominal surgeries. And the pregnant woman should not perform this asana. These asanas should be avoided by the individuals, specific individuals. Person, you will never do this exercise. If a person suffer from this problem, hernia, back injuries, and head catches, and the recent abdominal surgeries, you will never do this asana, and the asana name is Bhujangasana. And the pregnant woman should not be perform this asana. If she practice this asana during during she pregnant time, she will face the various type of problem. And the second asana is the Pushy Matasana. What is the procedure of Pushy Matasana? Sit with straight legs in front And what is first procedure of the asana is sit with straight legs in front. Second, try to touch the forehead of the knee. Third is hold the feet. I will repeat again. What is the procedure of Pushy Matasana? Sit with, at first you sit on the floor, sit with straight leg in front, try to touch the forehead on the knee and hold the feet. If a person everyday practice this Pushy Matasana, this type of benefits he will face, he will see. First is relieves diabetes patients, control weight and prevent obesity. Third is back and leg muscle are strengthened and relaxed, cure gastric and indigestions and the constipation problem. This type of benefits you will see. And the contraindication is of the Pushy Matasana is if you are suffering from enlarged liver or spleen, acute appendicitis, then you should avoid doing this asana. If a person suffering from this problem, enlarged liver and spleen, acute appendix, then you should avoid doing this asana. Avoid if you respiratory disease, if you have this type of problem, respiratory disease, you will never do this exercise. If you have any back or spinal problem, if you face in long time of year this type of problem, the spinal problem, make sure that you perform this asana only under the expert guidance. The expert guidance he will face this, and at first you contact your doctor and he will advise this, he or she will advise this. If in this type of exercise you will do this time or this type of posture, at first you contact your doctors. And this is the contraindication. And third is the Pawan Muktasana. What is the Pawan Muktasana? What is the procedure of Pawan Muktasana? Lie down on your back. In the first step is lie down on your back. Second is feet together and arms beside your body. Third is bring your knees towards your chest. And fourth is place the thigh on your abdomen. This is the fourth procedure. Now we will know what is the benefits of Pawan Muktasana. The benefits of Pawan Muktasana are prevent and cure diabetes. Second is improve digestive functioning and cure obesity. Next, spondylitis. If a person everyday practice this Pawan Muktasana exercise, prevent and cure diabetes, he will if he have this type of problem diabetes, if he practice the Pawan Muktasana, he will improve his power. Okay, and prevent and cure diabetes, this type of problem he will never face. And improve digestive functioning, the digestive functioning will be improved. And cure obesity and neck spondylitis, this type of problem will be beneficial for his or her. And the contraindication, what is the contraindication of the Pawan Muktasana? You should avoid this if you have heart problem, if a person everyday face these heart problems and sleep disc and hernia, pregnancy and abdomen surgery, this type of 1 2 3 and 4 5, this type of 5 problem, if you have this problem, you will never do this Pawan Muktasana exercise. And the fourth is the Ardha Matrasana Asana. What is the procedure of Ardha Matrasana? The procedure of the Urdhva Matrasana is this left heel is kept under the right thigh. This left heel is kept under the right thigh at first. Second is the right leg is crossed over the left thigh. Hold the right toe with the left hand and turn your head and back to the right side. Fourth is the perform the same asana in the reversed position. The procedure. And what is the benefits of this Urdhva Matrasana asana? If a person everyday practice the Urdhva Matrasana asana, he or she will benefit. He will know what is the benefits of these asanas. First is keeps gallbladder and the prostate gland healthy. Second is enhance the stretchability and the back muscle. Third is alveolates the digestive elements. The digestive elements with the alveolates the digestive elements. And the third is the contraindications. What is the contraindication of the Urdhva Matrasana asana? The contraindications is women who are pregnant should avoid this asana. If a woman if a woman are pregnant, then he should avoid these asanas. Individuals who suffer from peptic nuclear hernia should perform these asanas only under the expert guidance. At first you contact your expert, then you will do this asana. And the third problem is asthma. Yoga for asthma. This asthma is, if you practice every day the Sukhasana, Chakrasana, Gamakasana, Bhujangasana, Pushy Matasana and Matrasana. If you practice every day the asthma, you will never face this type of problems. This type of disease is asthma. At first I will briefly discuss what is asthma. Asthma is an inflammatory respiratory disease. If the characteristic, it is characterized by episodes of wheezing, chest tightness and shortness of breath. These episodes often develop either spontaneously or after exposure to irritants such as tobacco, smoke, dust, mites or pollen. And the second stanza is, during the asthma attack, the lung cells in the lungs release a substance that causes inflammation and alveolus, which leads to the changes in airway. Smooth muscle tone and the bronchi tubes become more narrow. Asthma affects people of all ages, most often starting during the childhood. People must do regular yoga to cure asthma. Yoga therapy is the most preferred natural immediately for asthma, as it is the effective and has 2 side effects. If now we will know how to improve this asthma problem. If you practice this 1 2 3 4 5 6 types of yogasana, then you will recover this problem, asthma. First one is Sukhasana. What is the procedure of Sukhasana? The procedures of Sukhasana is sit with cross leg position. At first you sit on the cross leg position. Second is hands on both knees. At first your hands should be on the knees, up on the knees. And third is the lengthness the back. And what is the, now we will know what is the benefits of the Sukhasana. The benefits of the Sukhasana is the cures asthma, calms the brain and the strengthens the back, stretches the knees and ankles. If a person every day practice this asana Sukhasana, then he will improve this type of problem. He will never face this asthma problem. First is the cures asthma, second is calms the brain, strengthens the back and stretches the knees and ankles. The Concentrications of this asana is, if your knee and hip are injured, avoid this asana. If your knee and hip injured, and if your knee and hip injured, avoid this asana Sukhasana. You injured, if you ignore this asanas, avoid. If you have slip disc problem, you should take proper care. At first, if you have this type of problem, this slip disc problem, you should take the proper care. And the asana name is Shukasana. Next we will know Chakrasana. This is the second asana of the asthma problem. If you practice every day, you improve this type of problem, and you will never face this type of problem. And procedure, now we will know what is the procedure of Chakrasana. The procedure of Chakrasana is lie down on your back and fix your hands. At first we will know what is the procedure. Lie down on your back and fix your hands firmly on the ground. Second is, then raise the middle portion of your body upward. Raise it at as high as possible. Then keep your head downwards between your hands. This is the Chakrasana procedure. Benefits: if a man practice every day this type of asana, these asanas Chakrasana, he will face and this type of problem, these benefits he will see. First is cures back pain. If a person have back pain, if he or she practice every day Chakrasana, then he cures this back pain. And cures problem related to the kidney related problem. If you practice every day the Chakrasana, this kidney related problem will be solved. Helps in reducing obesity. And fourth is prevents the problem of hernia. and fifth is the stimulants pituitary and thyroid glands, and benefits this type of this if you practice everyday chakrasana, and this type of benefits you will see. The contraindications of the problem of this asana is: if you are suffering from head catch or high blood pressure, do not perform this asana. Don't perform this asana in case of shoulders impingement. Do not perform this asana if you have tendonitis in the wrist. This type of contraindication you will face. And the last one is this type of asana is Gamakasana. What is the procedure of the Gamakasana? The procedure of the Gamakasana is now we will know what is Gamakasana, what is the procedure of Gamakasana. The procedure of Gamakasana is: sit down with legs straight, fold your legs, sit on the left foot. Fourth is keep the right thigh on thigh, and fold the left arm behind your back over the shoulder, and right hand under the right shoulder. Hands clasp each other. And every day, if a person practice this Gamakasana, the benefits you will see: it makes legs muscle strong, it improves the function of lungs, and third is it also reduces the stress and anxiety. The contraindication of the Gamakasana is: avoid this asana if you suffer from shoulder, knees and back pain. If you have this type of problem, shoulder problem, knee or back pain problem, you will never do this exercise. You should have this asana in case of any knee injury. If you long time you will face this type of problem, knee injury, you will never do this exercise. The exercise name is Gamakasana. And next is the Bhujangasana. What is Bhujangasana? What is the procedure of Bhujangasana? The procedure of Bhujangasana is: lie down on the belly, and raise the upper part of the body with the support of hands. Look up. And this procedure is: the Bhujangasana is lie down on the belly and raise the upper part of the body with the support of hands. Third is look up. And next is the benefit. If a person everyday practice these benefits, if a person everyday practice Bhujangasana, the benefits is: it prevents and curbs diabetes, it improves digestive functioning. If a person everyday practice this Bhujangasana, and he will face the digestive problem. If he practice everyday regularly, he will never this type of problem he will never face. Third is it cure cold and bronchi problem, kyphosis, obesity, necks and spondylitis. If a person regularly practice this Bhujangasana, and the long time he will face this type of problem, obesity and kidney related problem, kyphosis. If you practice every day, this type of benefits you will see. It provides strength and agility. The agility and strength and problem will be faced, and he will practice this Bhujangasana every day, he will never face. And the contraindications of the Bhujangasana is: now we will know what is the contraindications of the Bhujangasana. The contraindications of the Bhujangasana is: these asanas should be avoided by individuals who suffer from hernia, back injuries, head catch and the recent abdomen surgeries. If a person everyday practice this asana, should be avoid the individuals who suffer from the hernia and back injuries and the head catches and the recent abdomen surgeries. If you have this type of problem, you will never do this exercise, the Bhujangasana. And second is pregnant woman should not perform this asana. And if a pregnant woman practice this asana, she will face many type of problem during this pregnant time. Okay. And next is the Pushy Matasana. What is the procedure of Pushy Matasana? The procedure of Pushy Matasana is: sit straight, legs in front. At first you sit straight and your legs should be in front, and try to touch the forehead to the knee, and you try to touch the forehead to the knee. Third is hold the feet. And the second is the benefit. What is the benefit of the Pushy Matasana? The benefits of the Pushy Matasana is: relieves the diabetic patient. If a person every day practice this Pushy Matasana, he or she will see these benefits: relieves diabetic patients, control weight and prevent obesity. Third is back and leg muscle are strengthening and relaxed. Fourth is cure gastric and indigestion and constipation a problem. And third is the concentrications of this problem. The concentration of the problem is if you are suffering from enlarged liver or spleen or acute the appendicitis, then you should avoid doing this asana. Second is avoid if any respiratory disease. If a person have respiratory disease, he will never do this exercise, these asanas. Asana's name is Pushy Matasana. Third is if you have any back or spinal problem, make sure that you perform that asanas only under the expert guidance. When you do these asanas, at first you contact the expert guidance this type of asana, then at that time you will do these asanas. This is the concentrications. And the next is the Matrasana. Matrasana is what is the procedure of Matrasana? The procedure of Matrasana is sit in the Padmasana. At first you sit on the Padmasana asana style. Next is the lie down in supine position and make an arch behind. Hold your toes with the fingers of your hands. Fourth step is stay for home time in this position. First, I will repeat again. The procedure of the Matrasana is: first is sit in the Padmasana positions asana style. Second, lie down in supine position and make an arch behind. Hold your toes with the fingers of your hands. And fourth is stay for some time in the positions. The benefits of the Matrasana is helpful in curing back pain, knee pain benefits. It also cures effects of eyes, skin disease can be cured, and good asanas for diabetes. If a person every day practice this Matrasana, he will face this type of benefits every day and in future. I will repeat again: the helpful in curing back pain and knee pain. It also cures defects of eyes, skin disease can be cured, good asana for diabetes. If a person every day face this type of problem, diabetes disease, if he practice every day, this type of benefits will see. And next we will know the contraindication. What is the contraindications of the Matrasana? The contraindication of the Matrasana is if you have high or low blood pressure, then you will practice every day the Matrasana, you will face different type of problem. Avoid if you have migraine or insomnia problem. If you have migraine or insomnia problem, you will never do this Matrasana exercise. Avoid if you have a neck injury or lower back problem. If you have the neck injury or lower back problem, you will never do this exercise. The exercise name is Matrasana. And the fifth problem is the hypertension. The yoga for hypertension. If a person every day the Vajrasana and Pawan Muktasana and the Tadasana, these three type of exercise, if you practice every day, you will never face this type of problem, this type of disease, and the disease name is hypertension. Now I will briefly discuss what is the hypertension. A person has hypertension when their blood pressure is more than 140 to 90. This condition can affect the arteries, valves, and other parts of the circulatory system. It's common at any age, but it is the most commonly found in adults aged 30 to 60 years old, these who are obese. Hypertension can also be a risk factor at heart disease and stroke, kidney damage, and other disease. People have mild high blood pressure, while some people have severe high blood pressure. First one is if you have this type of problem, hypertension, you will do this type of exercise. The first one, the exercise is Tadasana. Now at first we will know what is the Tadasana. The Tadasana is we will know what is the procedure of Tadasana. Come on the toes while keeping of the arms is the arms upward in the upward position. Second is hold the posture for as long as you can. Third is breathing should be normal. Second, the benefit. Second point is the benefit. The benefits of the of this problem is the better posture, cure cytopenia, and the improved physical strength. Fourth is the stronger thighs, knees, and ankles. Fifth is the contraindications. The contraindications of these asanas, if you practice every day this Tadasana, if you have this type of problem, if you have a high blood pressure, you should do not this asana. In case of the head catch or isomia, you should avoid doing this asana. I will repeat again the Tadasana once more time. At first we will know the procedure, next is the benefit, and third is the contraindications. Next asana is Vajrasana. What is the procedure of Vajrasana? The procedure of Vajrasana is sit with the flexed leg positions, hands are over knees. Third is back straight. The body is resting over the ankle. The benefits of the problem is control obesity. If a person everyday practice Vajrasana, he or she will benefited for this exercise. The benefits is control obesity. Second is improves legs muscle, and third is cures gastric problem. The benefits. And third is the contraindications. The contraindications of the Vajrasana is avoid if you have severe knee pain. If you face the long time the knee pain, you will never do this exercise. Second is recent surgery of legs or waist. If you surgery your leg or your waist, you will never do this exercise. And third is feel any pain of in the ankles. If you injured or any type of, if you suppose, I will give you an example. If you play in the playground, if you going to the playground for playing and you will face some injury, you will never do this type of exercise. If you have any problem on your ankle, you will never do this Vajrasana exercise. Next we will know the Pavan Muktasana. The Pavan Muktasana is, what is the Pavan Muktasana? The procedure of Pavan Muktasana is lie down on your back. At first the procedure is lie down on your back. Second is feet together and arms beside your body. Bring your knees toward your chest. And fourth is press the thigh on your abdomen with the clasped hand. This is the procedure. The benefits. At first this is the benefit. Now we will know what is the benefits. If a person everyday practice the Pavan Muktasana, he or she will benefited for this time, for this exercise. The benefits is prevent and cure diabetes. Second is improve digestive functioning. Third is cure obesity. Next, spondylitis. Third is the contraindication. The contraindication of the Pavan Muktasana is you should avoid this if you have heart problems, sleep disc and hernia, pregnancy and abdominal surgery. If you should avoid this exercise Pavan Muktasana if you have this type of problem, heart problem, sleep disc problem, hernia problem, pregnancy for women and the abdomen surgery. This type of problem if you have, you will never do this type of exercise. The exercise name is Pavan Muktasana. Yoga. Now we will know the short answer type questions. The short answer type questions for yoga is explain yoga and asana. Short answer type of, at first the first question is explain yoga and asana. The answer is yoga is derived from the Sanskrit word yuj. It means the unity of body, mind and spirit. Patanjali has been described as a way to stabilize the mind for the union of soul, Atma and God, the Paramatma. Soul means Atma and God means Paramatma. And asanas refers to the position in which a person sits, stands to do yoga. Asanas are beneficial for the muscles, joints and cardiovascular system or nervous system and the lymphatic system. It prevents the body from various lifestyle diseases. I will briefly discuss what is the yoga and asana. Now we will know what is the benefits of doing various asana. If you practice every day this type of asanas, if you practice this, the benefits doing various asana are as follows. First one is the asanas playing a significant role in making our muscles strong, and the asana improve the flexibility of the body, thus preventing injuries. Third is asanas ensure smooth functioning of the organs. Asanas help the mental development, and asanas help in relieving the tension and stress. And the asana help in curing lifestyle disease like diabetes and hypertension. Third question is, what is the role of yoga in lifestyle disease? The role of yoga, answer, the yoga plays the prominent role in preventing lifestyle disease are as follows. The role of yoga in lifestyle is, this question will come from the CBS 2019 examination. This question is the most important for this exam, or your this type of, if you will do this yoga course, or if you have doing the institution, if you are doing in any course, this question is the most important. What is the role of yoga in lifestyle disease? The yoga plays the prominent role in preventing lifestyle disease are as follows. Yoga gives relief from physical and mental alignments, and regular practice of yoga relieves mental stress. Yoga makes a person free from anger, anxiety and emotional disturbance, cold, cough, isomia and the asthma and constipation, arthritis, acidity, diarrhea, etc. can be prevented with the regular practice of yogic asana. Fourth is, the postural deformities can be prevented by the regular practice of yoga. Third, and the fourth is, what is obesity? It is the disease, and explain your answer. What is obesity? At first we will know in simple language what is the meaning of obesity, then we will say that obesity is a medical condition in which excess body fat is accumulated to the extent that it has a negative effect on health. Is it a disease? If you have this type of question you will face in any examination, then you will normally say that obesity in itself is not a disease, but the condition of obesity leads to many diseases. This because a person becomes extremely fat and the organ system cannot function properly. And when the body does not function properly, then it gives birth to many diseases like diabetes, hypertension, cardiovascular disease, etc. Fifth question is, write the detail about the benefits of the Urdhva Hastasana. Answer, the benefits of Urdhva Hastasana are as follows. It stretches the complete body and provide a good massage to the arms, spine, upper and lower back, ankle, hands, shoulder and calf muscle and thigh. It enhances the function of digestive system and increase the capacity of the lungs. This asana helps in improving the blood circulation of the body. It helps in improving the body posture. This is the fifth question, and the sixth question is, write down the procedure of Trikonasana. The procedure of Trikonasana are as follows. Stand straight at hand and the alongside, raise both the hands till they are not in line with each other, parallel to the ground. Inhale when you are raising your hands. Now bend towards the right and bend the trunk sideways and touch the right foot with your hands. Look up at the left hand. Return to the standing position. Repeat this with the left hand touching the left foot. What are the ways to prevent diabetes? Answer, the ways to prevent diabetes are as follows. Reduce the consumption of white bread and rice, processed food, surgery drinks, jam, jelly, etc. Eat whole grains like brown rice and oatmeal, the millets and vegetables and fruits. Do physical exercise that includes asana like Bhujangasana, Pushy Matasana, Papan Muktasana and Ardha Matrasana. At the 8th number question is, explain the procedure of any one asana used to cure diabetes. This question will come the 2020 examination of CBSE, Central Board of School Education examination will come this question. The 8th number question is, explain the procedure of any one asana used to cure diabetes. Answer is, Pawan Muktasana helps in curing diabetes. The procedure of Pawan Muktasana is as follows. This is done in a lying position. Lie flat on the back. Keep the legs straight and relax your body. and inhale slowly and lift the leg and bend of the knees being upwards to the chest till the thigh touches the stomach. Hold the knees and lock the fingers. Place the nose tip between the knees. Exhale slowly and come back to the original positions. This is the 8 number questions. 9th question is explain the procedure of Bhujangasana. This question will come 2019 examination of Central Board of Secondary Education examination will come. Answer is the procedure of Bhujangasana is as follows. This is done in a lying posture. Lie on the stomach and test your forehead on the floor. Third is keep the feet and toes together and touch the ground. Place the hands at shoulder level and palms on the floor. And the fifth is inhale and lift the head, chest, abdomen up towards the roof and keep the navel on the floor. Last point is pull your torso back and off the floor with support of your hands. And number 10 question is what are the advantages of Bhujangasana? The advantages of Bhujangasana are as follows. It improves the blood circulation in the body. It decreases menstrual and the irregulations in females. It strengthens the muscle of chest, shoulders, arms and abdomen. It is effective in preventing urinary disorder. It improves the functioning of the reproductive organ. It improves the function of liver, kidney and pancreas and gallbladder. Explain the procedures of Pushy Matasana. The procedure of doing the asana is as follows. This is done in sitting posture. Sit on the floor with the outstretched leg. Sit straight and raise both arms above your head and stretch up. Bend forward and hold the big toes with the middle and index fingers. Then exhale out slowly and try to touch the knees with your forehead. Number 12th question is difference between the Pushy Matasana and Pawan Muktasana. Difference between Pushy Matasana and Pawan Muktasana are as follows. The Pushy Matasana and another side is Pawan Muktasana. At first, Pushy Matasana is this asana is done in a sitting position. Pawan Muktasana, this asana is done in a sitting positions. Second point is it is beneficial for spine, shoulders and hip joints. Second points is another at that time this second question is it is beneficial for internal organs like the liver and kidney. This asana is beneficial in curing diabetes and asthma. This asana is beneficial for curing diabetes or hypertension. 13 number question is what are the main cause of asthma and what symptom does it show? The main cause of asthma are as follows. Allergy from the airborne substance like pollen grains, dust, mites and mold etc. Air pollutants and the irrigants like smoke suspended in the air. Respiratory infection like common cold. It can also occur due to the genetic factors. The symptoms of asthma is the shortness of breath, coughing, sneezing too much and the frequency and the respiratory infection, chest tightness and the wheezing. The symptoms of asthma. This is the symptoms of asthma. 14th number question is what do you understand about the hypertension? Describe the procedure for performing any one yogic asana which reduce the hypertension. Answer. Hypertension occur when the blood pressure of a person become abdominally high and beyond the acceptable limits. One yogic asana which reduce the hypertension in the Tadasana, mounting pose or tree pose. It is the performed in the following ways. Stand erect and place your legs slightly apart with your hands hanging alongside your body. Make your thigh muscle firm and then lift your kneecaps while ensuring you do not harden the lower part of your belly. Hold the pose for 10 to 20 seconds and return the normal position. The repeat is 10 times. Number 15 number question is state the contraindications of Gamakasana and the benefits of the Sukhasana. There are following contraindications of Gamakasana is those who are suffering from shoulders, knee or back pain, shoulder avoid it. pregnant women should avoid it. There are following benefits of Shavasana. It relaxes the whole body and it releases stress, fatigue, and depression and tension. It improves the concentration and cures isomia. It helps the calms of mind and improve the mental health. It regulates the blood circulation. Total 15 question. I will discuss total 15 question, and next we will know in brief long LA type questions. First question is the explain the contraindication of Padhasthasana and Matrasana and the Urdhva the Hastasana. Hastasana. The answer is first one is the concentration of Padma Hastasana are as follows. This if a person who is suffering from a spinal problem should avoid doing it. Also avoid if you have any type of knee or back injury or neck injury. Contraindications or Ardha Matsandasana are as follows. Avoid doing this pregnancy time and the menstruation time due to the strong twist in the abdomen, and people with heart, abdominal, brain surgeries should avoid this asana. These who are having a therapy and the peptic nuclear and the hernia should avoid it. Those with sharp spinal problem should avoid it. Those with mild slipped disc can do, but it serves cause it should be avoided. Thank you. Today the topic of my presentation is over.